Yeah, due to some technical glitches, there was some issue with the mic, and we are recording this video once again. Welcome back. We are starting with the upper limb in anatomy section, and today we are going to learn about breast, a very important end marker. You can't miss out. If you, I think this is the first chapter in your BDC and other textbook. Then yeah, let's jump into it. Right, means every time I say the same thing, that don't forget to make a proper notes. And first, yes, mark my word, if you make a notes, you'll be like cracking your anatomy exam very smoothly. Otherwise, you'll be having a headache during your exams. That's it. Yeah, as a senior, I just suggest make a proper video, like not a video, that's my word. Make a proper notes so that you won't get frustrated during your exams. And mark my word that during your last day, I mean tomorrow will be your anatomy first paper, and you don't know what to do in your life, then your notes helps, right? Yeah, let's start the video. Okay, today we are going to learn about breast, as I informed. Breast, yeah. So it is also called as mammary glands. So let's dig into some embryology portion of the breast. Okay, so usually breasts develop in the milk line. So what is milk line? It extends from axilla till the ventral till the ventral aspect of the body of embryo. Oh, this is called as your milk line. Usually we see the breast development in 4th week of intrauterine life. Yeah, then your fibrofatty stroma, it will be developing from the mesoderm. Yeah, this is your milk line. We make some points like above the clavicle, at the breast, and at the level of umbilicus, like mid axillary line, then coming above the hip and the anterior part of the upper thigh. Then we'll join that line roughly, so that we call that line as milk. And you will learn about some anatomical defects in your surgery, where you will be seeing like more than one nipple will be present in the body, or like multiple nipples will be present in the milk line. So usually that will be a defect in the development of the breast. I hope that was clear, right? Yeah, coming to your anatomical proper anatomy, then usually breast extends from second to sixth rib in the vertical manner, this manner, right? In horizontal manner, it extends from your sternum to the mid axillary line. Okay, so mid axillary line, this is the lateral part, right? This is sternum is in medial, right? Okay, that was clear, I guess. Yeah, then coming to relationship, we'll divide it into superficial and deep. In superficial we have skin, superficial fascia. In deep we have muscle fascia. Then we have loose areolar tissue of retromammary space, where muscle includes, we have three muscles. Okay, don't forget, medial, lateral, and inferior medial. Okay, pectoralis major, it is medial. Serratus anterior, which is lateral, and external oblique, which is inferior medial. Okay, that was clear. And structure, yeah, coming to structures, there are three: skin, parenchyma, fibrofatty stroma. In skin we have nipple and areola, where we'll try to incorporate a small portion of topic under this nipple. Two lines. Okay, nipple, dark conical projected skin, which is made up of smooth muscle fibers. Okay, we'll learn this topic in we'll draw a diagram of this smooth muscle fibers in our histology section, and we'll try to incorporate more knowledge about this topic, I mean more information, and we'll make you fit in the histology too. Don't forget to check out this video, check out that video, right? Yeah, then which is like what we'll say, pierced by 10 to 15 lactiferous ducts. And coming to notes, we'll be providing the PDF after the yeah, after the video. You can just check out in the what will say description thing. We will be updating this. We are discussing whether to provide this written part or like a printed notes. I prefer the written part will be helpful. If you take a printout and you will be just watching my video, like it's like a premium subscription, which I don't take any money. So you can just open your YouTube and just look into my video. Okay, we'll discuss about that thing in some other video. Okay, let's continue in the topic. Then areola, numerous modified sebaceous glands which secretes oily secretion. So what is the function of this oily secretion? It prevents nipple from drying and cracking, right? Yeah, like you can adjust the video according to your speed, or whether you can keep it as 1.5 if I'm feeling, if you are feeling I am telling slow, and if I'm say, like if you're feeling I am saying in a faster manner, then you can go with the 0.5 or something, whichever you want. Okay, that is the main motto. At the end you have to understand, okay, and make the proper notes, right? And coming to second part, parenchyma consists of glandular part, which includes alveoli, lactiferous ducts, and lactiferous sinuses. Hope that is clear. Fibrofatty stroma, ligament of Cooper, fatty stroma, fibrous septa. We call ligament Cooper as a fibrous septa, right? Or how it looks like fibrous septa? See, it extends from the breast skin till the pectoralis major. What is the function, or what will say, what is the main motto of this presence of this Cooper ligament is like it gives proper shape. So in exam, if anyone asks why breast is having hemispherical shape, you need to write this as a breast shape. Okay, don't forget. I forget that to incorporate in the structure, so I wrote it here. Okay, so why how the breast will get the hemispherical shape, and it is all credit goes to your Cooper ligament, right? Yeah, that was clear. Then coming to blood supply, and I want to inform that first year students, like if they ask blood supply, don't only write the arterial or venous or something else. You need to incorporate all three sections which comes under blood supply. What and all will be included? Arterial supply, venous supply, and lymphatics. And let me clear that in every topic there will be some important topic related to arterial or venous or lymphatics. And coming to breast and its lymphatic, it just like it's a 5 marker. Okay, and if you want to study one topic from the breast while going to exam, and it's a lymphatics, don't forget. Okay, then coming to arterial supply, internal thoracic artery, we made a mnemonic IAP. IAP means, yeah, 4th years Indian Academy of Pediatrics, right? Yeah, first years, just remember it's a Indian Academy of Pediatrics. You will be learning the struggles given by IAP to the 4th year students. You'll come to know when you come to 4th year, right? Internal thoracic artery, we have 2nd, 3rd, and 4th perforating branches given by the internal thoracic artery. Then coming to axillary artery branches, these are lateral, superior, and anterior thoracic. Then we have posterior intercostal artery, which is a which gives a branch of lateral branch, right? Yeah. Then coming to venous supply, see, if there is a big structure, then it should be drained by multiple veins. So if there is some multiple veins they have to drain, we call it as a plexus, right? So this you'll see in various, like even in eye and all. We'll discuss more in further videos. Just remember it will be drained by a circular plexus vein, venous plexus. Okay, so here we have IAI, internal mammary vein, axillary vein, then we have intercostal vein. And coming to very important topic of the breast, lymphatics. I try to incorporate these keywords, like which examiner will be like expecting in your answer. You can write n number of answers related to this topic, but examiner require these keywords you have to mention in your answer to fetch for 5, 4, or sometimes examiner will be like, okay, he wrote everything in a first year, so we'll give him 4.5. Don't expect 5 and all. No one gives, even I won't give. Okay. Then coming to lymphatics, we'll divide it into 2 sets, nipple plus areola, excluding. So we have 2 important guests in our nipple, breast. Those are nipple and areola. These people will be dominating over others. So those will be like separate. Okay, we'll go with a separate route. Then we'll say, so what about others? Others will be having some other thing. They'll say, manage with some other thing. Okay, don't give me so much tension about the other people. We are important people. So other people is having some other drainage things. So excluding nipple and areola. So coming to nipple and areola, we have 75, 25. Just remember 75, 25. 75, your axillary group. Axillary group includes apical, central, anterior, posterior, lateral. Don't make more mnemonics, just be conceptual so that you will remember more long time than the mnemonics. At the end what happens, exam mein kya hoga, like, okay, I know the mnemonics. She looks too pretty. Try to catch her. I'm saying just about my experience. She looks too pretty. Try to catch her. And I'm get confusing like T is trapezoid or something that you can't remember. Okay, if you make proper like conceptual, you will remember well. So these are only 5. When you come to fourth year, at the end you will be like, ये तो बच्चा है, why did I make a mnemonic on this topic? Okay, like that. Apical, central, anterior, posterior and lateral. Okay, these are 5. Okay, we discussed about this. We are done with the axillary group. Then 20% parasternal nodes. Then we have for 5% posterior intercostal nodes. Right, I got confused. Then we made a breast. This is a breast diagram. Okay, we usually divide the breast into, or take this as a medial, this is a lateral. See, this is a superior, medial, so inner. This is inferior, so inner. This is inferior, outer, superior, outer. Okay, I hope this is clear, right? This was the main basic motto of this diagram. So in superior inner, supraclavicular nodes will be training. Inferior inner, we have parasternal nodes. Then inferior outer, we have subdiaphragmatic nodes. Then superior outer, axillary nodes. I'll make this part as a like from this video I'll cut this portion, so that when you go for your final exam, just on this video don't forget to watch this portion of the video. Okay, this is very important. You'll get a 5 marker. Even I got the 5 marker. I'll say how I got the question. Okay, then coming to diagram, you need to draw the diagram. People expect examiners expect you to draw a neat diagram. Since I'm not writing the exam, I'm done with the exam, so I'm not drawing a neat diagram. Okay, you need to draw a neat diagram. Go with your standard textbooks like BDC and all. You'll get a good diagram. Okay. Then we have internal mammary lymph nodes. And coming to this one, just look into it. From here, this goes to anterior to apical, central, then it goes to apical. So this is your apical. Apical drains into major vessels. Okay, this was your basics, and this is your posterior, anterior, lateral. Okay, then how I got these lymphatics in my final exam is like, they gave a pure orange as a clinical question. There was some orange peel like appearance. So what was the diagnosis and the structure involved in the condition? So it was all about lymphatics. So first you need to write these 2 lines for the diagnosis thing, then you have to go with the lymphatics thing. Okay, so what is the pure orange? It's an orange peel appearance. Why you will be looking orange peel appearance on the breast? So it's a subcutaneous lymphatic drainage obstruction, right? What it leads to? It leads to edema and deepening of the mouths of the sweat glands and hair follicle. So then coming to your clinical surgery, you will be learning, it's a huge chapter in surgery. And if you come to 4th year, and 4th year people will be knowing how bulk it is. So it's all related to Cooper's ligament deviation and all. We'll be discussing in the surgery video. If you're interested, you can go and watch my surgery video on the breast, which is not available. We'll be working on that segment to give as soon as possible. So this was all about your breast, and I think this was a small video. When you compare to other people, I try to make it small and just revise. So at the end, what is the important? Yeah, topic is important for me. You need to subscribe, right? I hope you people enjoyed the video. Study anatomy repeatedly to revise. How many times you revise, you'll be remembering that much. Good. Yeah, that's it. Hope you guys enjoyed the video. Yeah, thank you. Have a great day.